I wouldn't have the Order of Canada lapel to validate the great track record that he has. I'm going to be pretty brief. I'm going to basically set the table, so to speak, in regards to what Canadians think or some views that they have related to public health care, what's going on, health care as a national issue of concern, and then I'll be passing it on to Dr. Evans to get into what's actually happening out there on the healthcare front. So I was told there would be something to advance the slide here. I will not randomly press things on the desk, but Bob has control of my presentation too. So we'll go like this. So a longitudinal chart of the top national issue of concern that Canadians share with us. So this is unprompted. We just basically quite simply ask Canadians what their what the most important national issue of concern is. You can see the blue line is healthcare, the red line is the economy, green line is the environment. So you can see over the last number of years, back in 2004, healthcare really towered over all the other issues as a top national issue of concern. And then you can see two spikes. Those two spikes are the Romano and Kirby reports, where Canadians tended to focus a little more on healthcare when there was a greater dialogue as a result of those two initiatives. The green spike in the middle is actually the only time in our tracking that the environment has actually surpassed healthcare as a #1 issue. And if you remember, that was when we had a newly elected Conservative government, and there was a focus on Kyoto and whether Kyoto would be ratified. We had a green Christmas, and there are also issues related to the Minister of the Environment at that time and how the file was being managed. But the most dramatic spike you can see is the economy. You can see late 2008, early 2009, the meltdown in the economy basically dominated the human, what I'll say, the Canadian mindset, so to speak, as a top national issue of concern. Two key takeaways from this particular chart. You can see that on any given day, regardless of what is in the news, catastrophic or otherwise, healthcare is either #1 or #2. Second of all, we can see now the trend that as Canadians believe that the economy is more stable, they're less focused on the economy as an issue. And what we're seeing is a regaining of the first position for healthcare as a top national issue of concern over the last 2 months. So those are the key takeaways in regards to the trend. And it's important to remember that when we look at this particular question, it's usually a factor of two things. First of all, issues that touch the day-to-day lives of Canadians. So for average Canadians, the question is, if they're living in rural Canada, do I have a doctor? Will my mother get a hip replacement? Can I access a procedure that I want to access? Those are very practical, real things for Canadians. Likewise, other issues such as jobs in the economy. Do I have a job? Will I have a job? Can my son or daughter get a job when they graduate from college or university? So it's not surprising, because healthcare touches the day-to-day lives of Canadians, that it's always #1 or #2. So then we went on to ask a question related to public health care. Thinking about the future of Canada's public health care, would you support, somewhat oppose, or oppose public solutions to make our public health care stronger? And you can see 87.3%, or almost 9 out of every 10 Canadians, support or somewhat support what I'll say public solutions for our healthcare system. So it's quite a clear majority. What's actually interesting is when we look at this over time and by region. So you can see, comparing May 2009 to the most recent wave in May 2010, very stable national numbers. But even with these very stable and strong numbers nationally, we have seen in the last year some regional variations in the numbers. We can see, first of all, that in Quebec, support remains very strong at 81%, but that it's actually dropped just outside of the margin of accuracy for the subsample in Quebec. Conversely, in Ontario, what we've seen is a ramping up, at least, of support for public solutions from 84 to 91.8%, which is significant. In Ontario, I think a lot of this has to do with focus on the economy and people concerned about different issues related to their health care. And we also know that in Ontario, there's been a greater focus on pharmacies and pharmacists as an issue over the last month. And that has probably kind of brought into focus for a lot of Canadians, and specifically Ontarians, the issue of kind of how our public system works and what we need to do to make it viable, and what we need to do to ensure that it can deliver, continuously deliver, high-quality health outcomes over the long run. A new question that we asked was related to perceptions of cost drivers, and I thought this was quite interesting. You know, it actually took a long time to write this one question because of the complexity of the issue, and kind of after looking at the issue for quite a bit of time, I kind of decided that what was best was to get a directional feel on where they thought cost drivers were coming from. And we basically prompted Canadians with two different options. One, that costs are being driven by increases in spending for public health care, such as hospitals and doctors. And then the other option was that health care increases were being driven by things which are partially covered or not covered by public insurance, like dentistry, eye care, prescriptions, and physiotherapy. And what you see basically is division. You know, there's no real consensus opinion on this. About 1 out of every 5 Canadians, or 22%, are outright unsure. 43% of Canadians nationally think that the rising costs are a result of public health care, doctors and hospitals. 34% think that it's a result of those other items that are partially or not covered by public insurance. But even within these numbers, you can see some interesting variations. If you step into the province of Quebec, 55% of Quebecers think that the rising costs are directly related to doctors and hospitals. While if you shift over to the prairies, for example, you can see that people that live in the prairie provinces are more likely to think that it's those other items that are not covered by public insurance that are driving costs, compared to those in other parts of the country. So, what are the key takeaways? We should expect greater focus on healthcare as an issue on the part of Canadians. Now, whether politicians talk about healthcare is a different issue, but in regards to what Canadians are interested in hearing about and what they're focused on and what they're concerned about, healthcare is continuing to increase. Second, there's strong support for what I'll say, making the system work and delivering even better healthcare outcomes for the long term. And when I say the system, I mean the public system. That's obviously the first choice of Canadians by a significant, hands-down, slam-dunk margin. And finally, when we ask Canadians what they think is driving the costs, the rising costs of healthcare, they're either unsure, misinformed, or just have a diversity of opinion in regards to what's going on. And that basically is it for me. I think that's a good, what I'll say, setting of the table, so to speak, for Dr. Evans to present some numbers in regards to what is actually driving costs related to healthcare in Canada.